bone marrow failure and what it might have to do with your job. The bone marrow is the soft tissue inside bone cavities. In a healthy person, bone marrow generates new blood cells. Those blood cells originate as a stem cell, and then as the cell divides, it first becomes an immature red blood cell, white blood cell, or platelet-producing cell, which eventually matures to its corresponding type. Blood cells have expiration dates that range from a few hours to as long as 120 days, and therefore need to be replenished fairly often. The types of blood cells and the number of blood cells produced will depend on conditions. For instance, if the oxygen content of tissue decreases, kidneys will send a message to the marrow to produce more red blood cells. If the body experiences an infection, the bone marrow produces more white blood cells. If the body is injured, more platelets are produced. Myelodysplastic syndrome, also known as MDS, occurs when instead of developing normally, the blood cells die while still in the bone marrow or just after entering the bloodstream. As the number of immature and defective blood cells begins to exceed the number of healthy blood cells, it can lead to fatigue, infections, and bleeding. This can happen as a result of exposure to some cancer treatments, such as chemotherapy or radiation, or to toxic chemicals such as tobacco, benzene, and pesticides, or to heavy metals such as lead. You may have seen ads for this disorder because it is often a result from work environments. However, genetics, blood disorders, and genetically inherited conditions such as Down syndrome, Fanconi anemia, Shwachman-Diamond syndrome can also cause MDS. And still other types of MDS have no known cause. Compared to other types of diseases, it is fairly rare. Only about 200,000 cases are diagnosed each year in the United States. Symptoms of MDS include shortness of breath, fatigue, easy bruising, and paleness. MDS is a group of disorders rather than a single disease. MDS may eventually become leukemia, and in fact is also called pre-leukemia. Don't let the term pre-leukemia fool you. MDS is a cancer. Its diagnostic code was changed to cancer in 2001. And like most cancers, it runs the gamut from less aggressive to more aggressive. People die from MDS, not just with MDS, according to Amir Zaiden, MBBS, MHS, in an August 2020 article in the American Journal of Managed Care, AJMC, a peer-reviewed publication. According to Bart Scott, MDS, MS, in that same article, there is an increasing incidence of MDS with age at around 70. Medical providers have to do a better job of diagnosing MDS. On average, the patients reported that there is a 6-year delay between the initial finding of them having an abnormal blood count, finding, and being diagnosed with MDS. The important thing to understand is that early diagnosis can be critical as outcomes can be improved and some patients can be cured. One reason the disease is so hard to diagnose is that most cancers show immature white cells in the blood, whereas MDS differs because those immature cells remain in the bone marrow. Historically, doctors often chose not to do bone marrow biopsies because patients are typically older and doctors previously saw the bone marrow biopsies as being invasive. Thankfully, there are more effective therapies over the last 10 to 15 years. In its early stages, MDS rarely causes signs or symptoms according to the Mayo Clinic. In time, it may cause fatigue, shortness of breath, unusual paleness associated to anemia from low red blood cell counts, easy bruising or bleeding due to a low blood platelet count, and pinpoint-sized red spots just under the skin caused by bleeding and frequent infections due to a low white blood cell count. If you have symptoms or signs, see a doctor. A doctor may perform blood tests and a bone marrow biopsy, which is the removal of a small piece of bone with its marrow. Treatment can help the condition, or I should say treatment can help manage the condition. Prevention of the disease includes the usual suspects: quit smoking, avoid exposures to chemicals and metals that cause MDS, avoid exposure to industrial chemicals known to cause cancer, eat a healthy and nutritious diet, exercise regularly, and maintain a healthy weight. If you've already been diagnosed with MDS, wash your hands frequently to reduce infections, eat properly and hygienically prepared foods, eat a healthy diet, and stay away from people who are ill. Seattle Cancer Care Alliance, also known as SCCA, is recognized as a Center for Excellence by the Myelodysplastic Syndrome Foundation and is recognized for its higher than expected bone marrow transplant rates. To hear survival stories and read more about SCCA's record for people with MDS, go to the website at www.MYELODYSPLASTIC-syndrome. We have a extra piece here for the article that talks about asplastic anemia and MDS International Foundation. The phone number is 800-747-2820. Or the website is help@aamds.org. Population served: patients and families living with aplastic anemia, myelodysplastic syndromes, MDS, paroxysmal nocturnal hemoglobinuria, also known as PNH, and related bone marrow failure diseases. Mission: to support, connect, and educate patients, caregivers, and health professionals on bone marrow failure diseases worldwide. Free educational materials available. Information on research, treatment, and clinical trials. Online Academy. There are live webinars, webcasts, interviews with experts, and interactive learning modules. There are peer support networks. Patients and caregivers can speak with trained patient volunteers who share treatment experiences and provide emotional support. And lastly, community connections, which are volunteer-led regional support groups connecting patients and families.